one of the things that I see really on social media that's really getting confused is people are confusing social distancing with quarantine. You know, a lot of people will ask, hey, can I go out for a run? Can I take my kids to the playground? Yeah, we're not asking people to stay home. We're just asking people limit your interactions with other people. Because the way the virus is transmitted, if I live there and I sneeze in my hand and I go shake the hand of my next door neighbor and then he picks his nose, now he's got the virus. So the concept of social distancing isn't stay home, don't go out. It's when you do go out, figure out how to limit your interactions with other people, avoiding those large groups. Don't go to Sunday Mass or church or whatever it is. This is why schools are canceled, because these are big groups of people every day, all throughout cities. You know, if your employer offers you the option of working remotely from home or teleworking, do it. You know, you got to go to the grocery store, go to the grocery store. But think about when to go. You know, can you go at an off-peak time when it's a lot less crowded?
One professional courtesy I was thinking about, I mean, it just occurs to me that people like you, people in the healthcare profession, are really the shock troops of this pandemic. And you have the most information, but you're also vulnerable in your own way. You're going to be using best practices, but every doctor or nurse or healthcare professional that gets sick is one less informed person who's there to help. So for people who are in that 15% who really, really feel that they need to go to the doctor,
Absolutely.
I want to preempt people. I want to preempt assholes who show up and are very demanding about things that you cannot give them. So what should they keep in mind if they are that 15%?
If you're that 15% and you think you're getting sick, get in touch with your doctors. Absolutely get in touch with your doctors. And odds are your doctors may have protocols and procedures in place that may limit them actually seeing you, but it doesn't mean you can't interact with them. In my clinic, we're moving a lot of our visits into like video visits or telehealth, or just the other day, they announced at a press conference that they would allow doctors to use things like Skype or FaceTime to reach out and get in touch with patients. So, I think it's important to understand that, it's not that we don't want to see you. It's just that we need to figure out how to still see you and how to still take care of you while protecting ourselves, our staff, and our patients who aren't sick. So I think if you're one of those 15% who's having a little rough go at this, reach out to your doctors and understand that they're going to look at alternate avenues to get in touch with you, to evaluate you, and to get you taken care of. Some cities, they have like clinics that are designated for people who suspect they might have COVID-19. Other places, you may have an extra layer of questioning that, your front office, that your doctor's receptionist may ask you, and your doctor may do stuff like, well, what I'd like you to do is come to the office. Let me give you an example of what we do. I'll sit there. If someone calls me and says, hey, I'm really sick. I don't know if this is getting worse. What should I do? I said, all right. After we get through the usual intro of questioning, I'll say, why don't you drive to the office? When you get to the office, you call my front office. You stay in your car. Once we get a call from you, we're going to send somebody out there. It might be either me or my nurse. We'll go out there. We'll get a sample. We'll swab you. We'll do an initial evaluation on you. We'll do that outside so you don't have to come into the waiting room. And then we'll decide if you should go to the emergency room. Because the emergency rooms right now, they're getting crushed with people who shouldn't be there. They're getting crushed with people who say, hey, I got a little sniffle. I think I'm worried about having COVID-19. And doctors are saying, go to the emergency room. No, if they got a little sniffle and they're young, tell them to go home and tell them to stay home for at least 14 days. The emergency rooms need to be saved and preserved for the sickest of the sick, because we're going to see a huge upsurge in cases. And if 15% of however many million Americans get this, that's going to be a huge, huge logistical strain on United States healthcare resources. So if any of your listeners are sitting there and they're going, well, golly, I think I don't care what your age is, if you feel like you got a bad cold or flu and it's getting worse and you're having trouble breathing, reach out to your doctors. They may have you contact one of their nurses, or they may have you do an electronic visit or a video visit. And we're trying to make this up as we go along. So I would love to tell you that the way we're doing this in medicine is smooth. It's not. It's rocky, it's bumpy, and we're making a lot of mistakes trying to refine our procedures and protocols and processes so we can get people taken care of. Because we don't want well patients to get sick. We don't want us to get sick. I don't want my
Yeah.
staff to get sick. But by the same token, I want to make sure everybody who's sick gets an evaluation, gets taken care of one way or the other. And some of the ways we're doing that are going to be very different. This pandemic is rewriting a lot of the rules about how we practice medicine in the United States.